I'm particularly excited to discuss practical approaches to treatment individualization in the real world setting. We have excellent clinical trial data supporting many frontline regimens, but one of the most common questions clinicians face is how to apply that data to patient sitting in front of you.
Today we're sitting down with Ashley Chen, PharmD, to share a preview of her live virtual rounds on newly diagnosed multiple myeloma on July 8th and 28th. Hi everyone, and welcome to today's iThruHealth interview. Today we have a special preview of our upcoming live virtual rounds on newly diagnosed multiple myeloma, or NDMM, which is being held on July 8th at 6 p.m. Eastern and on July 20th at 7 p.m. Eastern. And I'm joined today by one of the three faculty of the webinar, Ashley Chen, who is a clinical pharmacist in malignant hematology oncology at Fred Hutchinson Cancer Center, University of Washington. And today she's here to share a sneak peek of what she and the other faculty, Dr. Rahul Banerjee and Dr. Beth Feynman, will be discussing in the live virtual rounds. Dr. Chen, thanks very much for coming on today.
Yeah, thank you for having me.
Absolutely. Looking forward to hearing some more of your insights, both in the webinar and a little sneak peek today. So to start off, would you like to tell us, what is the role of pharmacists in working with patients with multiple myeloma?
So the pharmacists play a critical role throughout the entire multiple myeloma treatment journey, from treatment selection and supportive care to toxicity management, such as antiviral prophylaxis, thromboembolism prophylaxis, and bone health management, as well as adherence monitoring. So as therapies become more complex, I believe the pharmacists really help ensure that treatment plans are safe, effective, and individualized for each patient. We also help with manage treatment-related toxicities, review monitoring lab parameters, and coordinate dose modifications when needed.
Great, thanks for explaining. And of course, frontline treatment options for newly diagnosed multiple myeloma have expanded rapidly in recent years. So what makes treatment selection more complex today than it was just a few years ago?
Yeah, the good news is that outcome for patients with newly diagnosed multiple myeloma continues to improve because we have more highly effective treatment options than ever before. However, the increased number of options has also made treatment selections a little bit more nuanced. So a few years ago, most patients received triplet-based therapy, but today we're seeing increasing use of quadruplet regimens incorporated using specifically anti-CD38 monoclonal antibodies, along with evolving data around transplant strategies, maintenance approaches, and risk adaptation treatment decisions. So treatment selection now really requires careful considerations of disease-related factors, patient-specific factors, including age, comorbidities, treatment goals, and just logistical considerations. And these challenges is no longer simply choosing an effective regimen, but really selecting the right regimen for the patients.
Definitely. It's a lot of factors that go into the considerations.
Mm-hmm.
So as someone who works closely with patients throughout their treatment, what are the most common medication-related challenges you see during induction therapy, and how can the care team proactively address these?
Yeah, one of the biggest challenges during induction therapy is really just managing that cumulative burden of treatment. Patients are often starting multiple anti-cancer therapies alongside several supportive care medications, which can be really overwhelming for patients. So common issues include like steroid related side effects, peripheral neuropathy, cytopenias, infection risks. The list can really kind of go on and on. And so we also frequently encounter drug interactions and difficulty navigating medication access and insurance requirements. So the key thing is to being proactive rather than reactive. So early patient education, close follow-up, regular toxicity assessments, and just clear communication among the team can really identify these issues before they become treatment limiting.
Definitely. And the live virtual rounds will also be covering practical dosing strategies for multiple myeloma therapies. So why is individualized dosing so important, especially for patients who are frail or have comorbidities?
Yeah, individualized dosing is one of the most important aspects of myeloma care because patients can really vary tremendously in their ability to tolerate treatment. So, while clinical trials often report outcomes based on protocol-defined doses, many patients we see in practice are older, frailer, or have significant comorbidities that may not fully reflect the trial population that it was studied in. So for these patients, starting with or transitioning to a modified dosing strategy may improve tolerability and allow them to remain on therapy longer. So our goal really is not necessarily to deliver highest possible doses, but rather the most effective and sustainable dose for those individual patients.
Absolutely. So, what is one topic that you're most looking forward to delving into during the live virtual rounds and sharing with the audience?
Yeah, I'm particularly excited to discuss practical approaches to treatment individualization in the real world setting. We have excellent clinical trial data supporting many frontline regimens, but one of the most common questions clinicians face is how to apply that data to patient sitting in front of you, whether it's determining when to adjust steroids, managing toxicities that emerge during induction, or just tailoring treatment for older or frailer patients. These decisions can really have significant impact on outcomes. So I'm just really looking forward to discussing the strategies that clinicians can immediately apply in practice to optimize both the efficacy and tolerability for their patients.
Amazing. Well, thanks so much, Dr. Chen, for sharing this preview with us. We're looking forward to hearing some more insights from you and Dr. Banerjee and Dr. Feynman during the live virtual rounds. So for everybody listening, be sure to visit ithrohealth.com to register for the sessions on July 8th or 28th. Thanks again.
Thank you.
Thanks for watching. If you want to keep following these oncology insights, go ahead and click right here to watch our next story and dive into the latest clinical breakthroughs on our channel. And before you go, make sure to hit that subscribe button so you never miss an expert update.